Eyes and Shine. Today's education, we're going to be talking about the 5 top natural ways to prevent and treat age-related macular degeneration. Macular degeneration is a devastating eye condition that often causes severe vision loss. In fact, it is the #1 cause of legal blindness in people over the age of 60. And I can tell you just from my experience being in the eye clinic, occasionally I will have patients who come in and they're maybe around that time of thinking about retirement. And then they come into me because their vision's blurry and they think they just need an update in glasses. And then I have the unfortunate I'm placed with that duty to tell them that they have this macular degeneration that is leading potentially causing blindness in their lifetime. And it's really devastating. So in today's education, that's why we're talking about the things we can do, the lifestyle changes, the natural things, whether it be diet, supplements that we can take, things that research has shown us can prevent macular degeneration in the first place, slow down the disease once maybe you have it, and then other treatments that are currently available, and then some of the new treatments in the current research. So I'm really excited to be sharing with this with everyone here this evening. So thank you for joining. If this is the first time that we are meeting, my name is Dr. Joseph Allen. I'm a board certified doctor of optometry and a fellow of the American Academy of Optometry. And the Dr. Eye Health channel here is dedicated to helping people learn about the eyes, vision, so that you can keep seeing your best today, but also into the future and into tomorrow. With these educations that we do live, if you're catching this live or on the replay, let me know in the comments if you're catching us here live and maybe where you're watching from, and if macular degeneration is something that you've ever heard of. Is it something that maybe runs in your family, or if it's something that maybe your doctor has mentioned to you before. With these live streams, I do want to mention just a huge thank you and shout out to some of our channel supporting members, as these live streams are brought to you by our supporting members of the channel. If you want to learn more about becoming a channel member, then we do have links below the video as well as in the description below. It does offer a unique opportunity for these lives, as our channel members get priority when we do live Q&A toward the end of the education. So once again, huge thank you and shout out to our channel members in making this education possible. All right, so let's dive in and talk about macular degeneration. So what is macular degeneration? So when we look inside of the eye, the back part of the eye is called the retina. This is a thin tissue that is connected to your brain. It is neural tissue. When I look inside the eye, you can see on the far side here of my slide, that is really what I see when I look inside of the eyeball. The center part of the eye is called the macula, and I drew kind of a dotted line around it. In the center of that, it's a little bit darker. That's called the fovea. The fovea is the dead center part of your vision. So if you're looking anywhere around, that is like the reticule. That is the center part of where you're looking. If you're looking at a friend's face and you're looking directly at their nose, that's where you're going to be looking at. If you're looking at a single letter on a word like the word stop and you're looking at the T, that is using that center bullseye of your eye. And that's why macular degeneration can be so devastating, because you're losing that central focus point of your eyesight. So if we look deeper and we're able to see the single layers of cells within the retina itself, the back layer of the retina has the photoreceptors. It's got the rods and the cones that maybe you learned about when you were going through school that give us your ability to see and detect light. Behind these photoreceptors is a thin membrane called the retinal pigment epithelium, or the RPE. And then behind that is actually a meshwork of blood vessels called the choroid. Now, this is important because this RPE, this retinal pigment epithelium, supports and provides nutrients from the blood vessels behind the eye. This blood vessels get this nutrients through the RPE to the photoreceptors. Because the photoreceptors are constantly being bombarded by light energy, they need to constantly turn over. And that's why your retina is one of the most highly metabolic tissues in the entire body. And so it needs nutrients. Now, for some reason with macular degeneration, we don't fully understand why yet, But this RPE, retinal pigment epithelium, starts to kind of degrade and stops functioning correctly. And then you see a buildup of cholesterol, fatty plaques that start to build up. And oftentimes in the early stages of macular degeneration, we don't even see these plaques building up. It's subclinical. Doctors will look inside and be like, oh, the eye looks fine. But in reality, there's this thin buildup of this plaque or protein that we call drusen. And that's what these yellow spots that I put in here, that's what it kind of looks like. Drusen, when we look inside, you'll see these yellow spots. These often show up early in the disease, and they build up over time and get worse and worse. In fact, we can do a special test in the eye clinic called an OCT, or optical coherent tomography, and we can see these globs of drusen stuck in those back layers of the eye. Over time, as this drusen develops, it can start to break down, and what's left is the retina starts to thin out and some of the cells atrophy. In fact, we call this geographic atrophy, and this is more of the end stage of dry macular degeneration. And this ends up leading to permanent dots and dark spots in your vision that unfortunately we just can't recover. Now, if you ever go to your eye doctor and see, if you ever go to your eye doctor, they may talk to you about dry versus wet macular degeneration. And I have done a video on this before. Dry and wet macular degeneration, dry is more common, usually less severe. It takes a little bit longer to cause vision loss. Thankfully, it's more common that people have the dry form. But wet macular degeneration comes on really fast and can be absolutely devastating for eyesight. We call it wet macular degeneration because you can kind of see in that photo, there's some blood in the back of the eye. It's because of this blood. The reason this happens is because of these proteins that are building up in the back of the eye. There's high levels of oxidation as well as inflammation that occurs inside the eye. And all of this being that the retina cells are not getting the nutrients it needs, it starts to release something called vasoendothelial growth factor, or VEGF. And that's basically the cell saying, hey, I need more nutrients, I need oxygen, I need blood, I need metabolites, I need this, I'm starving. So it releases that VEGF, and new blood vessels are called toward that VEGF, and they grow into the retina kind of like weeds, or I think of it like roots of a tree that are growing through the foundation of the home. And that destroys the architecture of the house. And I think of that how the blood vessels can destroy the architecture of the retina. And these blood vessels are really fragile, so they can leak, they can break open and bleed into the back of the eye, as in this photo here. Unfortunately, and we'll talk about the different treatments for this in just a moment. Unfortunately, when it comes to macular degeneration symptoms, early on, the first symptom is in fact night blindness. And let me know if you've ever found yourself having difficulty in a dark room before, or driving at nighttime. Night blindness being the first symptom is really challenging, because usually when people are having macular degeneration, it's when they're about age 45 and older, usually age 50 and older, even more common. But a lot of times as we get older, we also are normally having more difficulties in night blindness. We're having difficulty in dim light. And then you also have formation of cataracts. And so it gets a little tough for even eye doctors to know if somebody's night blindness is really the symptoms of macular degeneration. Thankfully, there is a new device. It's been out for a little bit, called dark adoptometry, but there's new clinical tools that are becoming available that help doctors detect this earlier. So it's something you can always ask your doctor about if they have anything like that. As macular degeneration progresses, it starts to affect your central vision, causing blurred vision. You can see dark spots in the center of your vision. And this is, again, really tough. Makes it hard to read, makes it impossible to drive even. And that's why it can be really, really tough for people. Another symptom is distortions in your vision. The clinical term that we use in medicine is metamorphopsia. And just for trivia, that's my favorite word in all of eye care, is metamorphopsia. It's just kind of a cool word. But you'll see this on what's called an Amsler grid. And oftentimes, if you have macular degeneration, your doctor may give you an Amsler grid to take home to monitor your vision on your own. And I have put a link below this video to a website where you can get a free download of an Amsler grid if you want to get that yourself. I do want to give a shout out to a few people who are just catching this live. MD, thank you so much for just being here and supporting the channel. Thank you guys to everybody who is enjoying this content and giving it a thumbs up, because that'll help the channel and this information reach more people who need to see it. So what about treatments for macular degeneration? So that's the unfortunate thing with AMD, is that there's not a ton of treatments for it. Although there is some new ones in the research, which we'll go over. Dry macular degeneration, we really go for lifestyle modifications, which we're going to go over, some supplements and vitamins, which are indicated for dry macular degeneration. And then if you ever were to convert over to wet macular degeneration, unfortunately, I say it's a good and bad, but the fortunate things that we have a treatment for it. The downside to it is that it's an injection, a needle going into the eye, and we treat it with anti-cancer medications that help the blood vessels that have got into the eye, that helps them recede and helps all the fluid absorb. So it's a little scary for people to think that the treatment is injections inside the eye, but it's really an amazing discovery that we can treat people with this devastating condition. And if you do have wet macular degeneration, or you have a family member who has it, and nobody wants a needle in the eye, but thankfully, I do encourage anyone who has that condition to still go see their retina specialist and get those injections, because that's the only way for us to truly help maintain good vision, recover vision that's been lost when it gets into that condition, that level. So let's talk more about prevention and treatment. Again, if we can, let's prevent anybody from getting this condition, or doing our best to slow it down if somebody starts to have this any form of macular degeneration. So the number one thing is diet. If you dig into the research for it, diet is a consistent recommended lifestyle factor. With the diets, and we've talked about this on different types of eye conditions on the channel, but the Mediterranean diet has been studied the most and continues to rise and be the most supported diet for people to slow down the risk of this condition. One study, fairly recent in 2022, they did a systematic review of observational studies, and they did find an association with lower risk of developing macular degeneration, as well as a lower risk of progression to the late, more severe forms of macular degeneration with the Mediterranean diet. And they reported 67.1% decrease in the rate of progression when people did adhere to the Mediterranean diet. And that was just the diet. That was nothing else. No supplements, nothing, no other treatments. It was diet alone, 67.1% decrease. So pretty outstanding statistic. I do want to review just briefly what the Mediterranean diet is, because I know when I first even did my education, I didn't really understand what the Mediterranean diet was. In my brain, I thought, oh, Mediterranean, Italy, Italian food. I love pizza. I love pasta and meatballs, that sort of thing. Turns out the Mediterranean diet isn't that. Mediterranean diet is a little bit more old school, rural farmer community type of diet. And so it's really high on vegetables, fruit, legumes, grains, and nuts. Just a moderate intake of fish, poultry, dairy, and red wine. Olive oil instead of butter. So it's less focused on saturated fats, more on kind of the liquid olive oil fats. And then limited consumption of red meat. To break it down, if you want to be really into the statistics of it, whole grains, breads, beans, legumes, nuts, and seeds are about 35% of daily calories. Vegetables and fruits are about 30% as well. Olive oil is only 10%, so it's really not that much. So you want to be cautious with it, not getting too much, because it is a lot of calories. Fish and seafood is only a few times a week and about 20% of calories, but dairy products, eggs, poultry, yogurt, red meat, and sweets are all about 5% or less of daily calories. So it's quite the opposite from the standard American diet, which is pretty heavy on saturated fats, a lot of processed foods, pretty heavy on the meat consumption as well as sweets. So that's just something to keep in your mind. A further study looking at the kind of the eating, the dietary habits of people with macular degeneration, as well as supplementation. Everything on the blue side of this graph is good, with less with a decreased risk of developing macular degeneration. And then the other side is high dietary intake, showing linoleic acid, monounsaturated fat, oleic acid, saturated fat, strongly correlated with advanced development of macular degeneration. But I will kind of asterisk that there are good fats. We need fats in our diet, but specifically high dietary intake. So if people are eating excessive amounts of these fats, that's more associated with progression. And so this is a great graph I've got from this study, but it basically highlights, again, healthier diets and having less inflammation, being younger, not smoking. Those are all associated with having less chance of macular degeneration. But high fat diets, things that are more processed, leading to gut dysbiosis, which we'll talk about in just a moment, and leaky gut, that is more strongly associated with inflammation within the eye and leading toward macular degeneration. Now, if you didn't catch it before, we did a few months ago, we did do a live stream on the microbiome and the eye and how the microbiome can affect so many different eye conditions. One of them is macular degeneration. And there's even a more recent study that was just published in fall of last year that found that there's an increase of firmicutes and a decrease in bacteroidetes. These are different classes of microflora in the gut that are associated with macular degeneration for people who develop the disease. And it's also, coincidentally enough, the same thing seen in people who are obese and have really high-fat diets. And this leads to increased chronic inflammation and pro-inflammatory cytokines, which, again, plays a role in the pathogenesis of macular degeneration. So just one thing to throw out there that you can start doing is thinking about prebiotics and probiotics. Prebiotics really is fiber. And we know a lot of people's diets does not include too much fiber. And so just a quick list: chicory root, leeks, onions, garlic, asparagus, apples, whole oats. These are things that are very fibrous. These are considered prebiotics because they're really providing food to the already living microbes that are in your gut. Probiotics are fermented foods: kimchi, sauerkraut, tempeh, which is fermented, soybeans, dairy and non-dairy yogurt, and even sourdough and kombucha to some extent. But these probiotics are really bringing microbes back, introducing new microbes into your gut. So it's these are just kind of things to understand. Supplements of probiotics is a topic I want to learn more about. It's tough for me to recommend probiotics right now. I know some doctors do. There's many different brands out there. I'm currently going through a higher level doctor course in the gut microbiome in order to better understand it myself, so I can further educate the world about how it could be affecting the eye. So stay tuned for more content and give me a thumbs up and let me know if you'd be interested in learning even more about the gut microbiome and how it affects the eye and the body. So again, if you want to check out that video, if you didn't catch it before, this is what the thumbnail looks like, and I have a link to it below in the description if you want to check that out. Let's talk about supplements, because this is always some people love supplements. Let me know if you take supplements of any kind, or if you're someone who is kind of never been along with it. I know some doctors are very pro supplements, some doctors are not. But in the realm of eye care, specifically in macular degeneration, supplements are kind of a mainstay. The reason for this is two major landmark studies. We have the AREDS study, which is the age-related eye disease study, and then they have the AREDS 2 study. The original AREDS study was done in 1992 to about 2001, and then the second version was 2006 to 2012. In these studies, they gave a cocktail of certain vitamins based off of epidemiological studies and dietary factors, and they found that this could reduce the risk of progression of somebody going from intermediate stage macular degeneration to a late stage blindness condition for 18 to 25% over 5 years. So they slowed it down a considerable amount by taking these certain cocktails. The first one, the original AREDS study, I will say, had beta carotene in it. And the reason they had originally had beta carotene in it, and then they actually took that out for AREDS 2 because they later found out that beta carotene as a supplement, if you were previously a smoker, increased your risk of lung cancer by about 50%. And that was a no-go. So they took beta carotene out. and instead they changed some things. Now, the ones I'm showing here on the screen, this is just various brands. I personally have no interest in any of the companies that make any of these, but I know some of these you'll find at the supermarket. You can find these at vitamin stores. You can also find them at your local eye doctor's store or the optical, but various brands on the market. Usually, though, all of these brands will contain some of these same essential ingredients, including vitamin C, vitamin E, zinc, copper, and then lutein and zeaxanthin. These are in the new formulations. These are generally recommended when somebody has a diagnosis of an intermediate stage of macular degeneration or worse. That's when the literature shows it's statistically significant, and that's when doctors are more or less required to recommend it. In fact, in my electronic charting, there's a box that I have to click every time if somebody has macular degeneration. I have to click it whether or not I gave education and recommended this supplement. It's that important. However, in the research, it's not really statistically significant enough for doctors to recommend it at an early stage of macular degeneration or before somebody has been diagnosed with the condition. There may be some benefit, but it's not statistically significant in most studies. And so some doctors still advocate for it because they want to say, hey, even if it's a little bit, I want to do anything I can for my patient to slow down and prevent this from happening. So some doctors still recommend these AREDS 2 supplements for some patients. I do highlight zinc and copper for one reason. First, zinc, the original studies and formulations have a lot of zinc in it. And if you're eating a good diet, having 80 milligrams of zinc on top of that is associated with some side effects, things like risk for anemia and even some general urinary tract infections. So some newer formulations suggest that zinc isn't needed at that high quantity, and so it's sometimes brought down. And some formulations don't even have zinc at all, and that's because some other studies, and it's a little bit debated in the industry, some studies have suggested that based on genetics, some people may be at risk of advancing in their macular degeneration when they are taking supplements of zinc. Again, not fully agreed upon in the industry, but something to talk to your doctor about if they think zinc is really something they recommend for you. Copper is only in there because when you do supplement with zinc, your copper absorption decreases. So they add cupric oxide into this formulation to help with that. Now, at the bottom here, you have lutein zeaxanthin. And so let's talk about lutein and zeaxanthin. I've talked about this on the channel quite a bit before. We've done some dedicated videos on it. If you've never heard of lutein zeaxanthin, I wouldn't be surprised. But let me know, again, in the comments, or if you're catching this on the replay, let us know if you've ever heard of lutein zeaxanthin before. Lutein and zeaxanthin are mainly found in green leafy vegetables. They're also found in some forms of like bell peppers. They're also found in corn a little bit. Also some in avocado, some in pistachios, and even in egg yolk, although most of it in egg yolk is supplemented in chicken feed. They actually give lutein zeaxanthin to chickens because it makes their egg yolk a brighter orange color. Lutein and zeaxanthin are carotenoid pigments that go to your eye and to your brain. And when they go to your eye, they deposit in the front layer of the some of the front and intermediate layers of the retina, and they work as a filter. They actually stop light, high energy light, namely blue light, from penetrating deeper into the eye. And this is great because it ends up meaning your photoreceptors don't have this harsh energy bombarding it. And then lutein and zeaxanthin also have antioxidant capability and anti-inflammatory effects within the retina itself. So they're very powerful. In fact, this study, not too long ago, just in 2021, did report that higher plasma lutein is associated with a 37% reduced risk in incidence of advanced macular degeneration. And again, we've done 2 videos on this. You can check these out, and I put a link to them in the description below. Lutein has been found to improve other things, including some components of your eyesight, like contrast sensitivity. It affects your memory as you're getting older. It affects your cortisol and stress levels. It helps you with your sleep. And then even some newer research in children find that that can help them with their memory and their learning, along with these benefits for the eye. As far as the research is concerned, there is no daily recommended amount of lutein, but the research goes between 10 and 20 milligrams of lutein per day is considered pretty optimal. And then zeaxanthin, it's kind of like the brother sister. Zeaxanthin is about 2 to 5 milligrams per day is recommended. Zeaxanthin. Now, this one is for wet AMD. If you have a family member or yourself have ever had to have injections or is at risk for wet macular degeneration, this is a really cool study that came out just last fall. So they did a study where anybody who had wet macular degeneration in one eye and it was not affecting the other eye yet. If you don't take anything, you have about a 48% chance of developing wet macular degeneration in the unaffected eye. But they supplemented with 20 milligrams of zeaxanthin per day, and they found that that decreased the risk by 26%. So only about a 22% risk total in the unaffected eye, right? Because if it's affecting one eye, you definitely don't want it in the other. And so this was so dramatic that they eventually just, they're just like, wow, this is so significant. They're basically, and I would love to know, if anybody's watching right now or catching this on the replay, if you are a retina specialist or you work in a retina clinic, I would love to know if this information, this study changed your way of practice. Are you now recommending this much zeaxanthin to your patients, or have you never heard of this? Have you not seen this study? But just an interesting factoid, they took that information and they stretched out over how many people have this condition and how expensive it is, because getting injections into the eye sometimes cost up to like $2,000 per treatment. And so for how many people have the condition, it's going to save patients $6 billion over 11 years just by taking this supplement. So pretty amazing information. Now I'm going to nerd out a little bit, and we're going to talk about omega-3s, because this is always a debated topic in healthcare, period, for so many different things. And we've talked about omega-3s on this channel specifically for dry eye in the past, and there's even some new things with dry eye about omega-3s. So we'll be covering that in future videos soon. So if you're not a subscriber to the channel yet, subscribe and ring the bell so you get notified when we have this new information about omega-3s coming out. But omega-3s, when it comes to the retina, is pretty fascinating. So epidemiological studies find that people who eat fish have reduced risk of macular degeneration. And they even have specifically that fish twice a week reduce the risk of early and late AMD. But most studies, when they give people omega-3 supplements, not support it. And so there's always been this confusion of why is it that people who eat fish seem to have less macular degeneration, but if we give them omega-3 supplements, it doesn't seem to really help. But we know that omega-3s play a huge role with the health of the eye, because the photoreceptors in the back of the eye are about 50 to 60% made of DHA omega-3. Omega-3s have EPA, DHA, and then there's ALA. ALA is mostly from vegetable sources. But EPA is really good for like your skin, for your joints, supposedly for the heart, and then is more indicated for dry eye. But this DHA is more for your eye, your retina, and the neural tissue. So more recently, we started learning that there's different types of DHA. And I know this is a really complex slide, so I'm going to break it down a little bit. DHA, there's three forms. There's triacylglyceride DHA, or TAG, and that's the most common. And in fact, that's what most omega-3 supplements are made out of, triacylglycerol DHA. There's phosphatidylcholine DHA, which is found in fish sources, and as well as fish eggs or fish roe, as well as krill oil. And this phosphatidylcholine DHA is kind of unique because when it's digested, your digestion is able to break it off into the same triacylglycerol DHA that's found in omega-3 supplements, but it also breaks off into this special lysophosphatidylcholine, or LPC DHA. And this LPC DHA has more recently in the research, and I'd say probably in the last 15 to 20 years, has been found to be primarily the way we get DHA into the brain and into the retina through the blood-brain barrier and the blood-retinal barrier. And this is because of a certain transporter called MFSD2A. And no, this will not be on the quiz afterward, but it's just fascinating that now we recognize this transporter is essential for omega-3 DHA into these neural tissues. And there's this special type of omega-3, this DHA, this LPC DHA, that selectively binds to this transporter. So this starts to make sense why people who eat fish more often tend to have higher, better outcomes because they're having more DHA in the retina. Turns out that fish only contains about 1 to 1.5% of these phospholipid special types of omega-3. Fish roe or fish eggs, and let me know if you're a fan of fish eggs, because I know some people are very much not into caviar or you don't like fish eggs on your sushi. But fish roe has 38 to 75% of omega-3 as phospholipids. But again, omega-3 supplements, most of them have 0 of these types of phospholipids. I did do a quick research and found at least 2 different brands that are recently on the market with phospholipids in them. And I'll update them in the description. But the truth is, though, the research is still very new on this, and there's nothing to evidence-based to make recommendations on for people to take how much of these special type of omega-3s to take to affect the retina. But I just wanted to mention it there because it is pretty fascinating and newer research. And so expect that there's going to be more coming out. And I imagine more eye doctors are going to be talking about this as we know more. 2 recent publications using specifically that LPC DHA, they've been basically taking krill oil and using some chemical processes to isolate this LPC DHA and giving it to mice. And they're finding dramatic 100-fold increase of DHA getting to the retinal cells. And this newer one, they're looking at Alzheimer's disease specifically because they're looking at this as potential treatment for Alzheimer's disease. And Alzheimer's disease does affect the eye. And so they're found improvement in retinal function. The function of the retina improved when they gave this higher special form of DHA to mice in these studies. So pretty fascinating. Let's move on to exercise and weight loss. Exercise and weight loss has been known to be associated with reducing the risk of early and late AMD. BMI originally was originally associated with, but then newer studies found the waist to hip ratio is better, and a 3% decrease of waist to hip ratio is associated with 29% lower odds of any form of macular degeneration. Specifically with wet macular degeneration, they've been looking more specifically at what processes, like how this actually happens. And basically, exercise itself exerts a protective effect of inhibition of ocular inflammation. And so higher physical activity does correlate with improved lesion recovery in wet AMD. The only challenge with this is that if somebody has wet macular degeneration, they don't see as well. And so it may be a limiting factor for some people to feel comfortable doing some forms of physical activity. So it's still, I think, again, if somebody has wet macular degeneration, I think any form of increased physical activity is better. And including this study, which found even 3 hours a week of low to moderate activity. This is just walking for 3 hours a week, had a 41% less likelihood to develop late macular degeneration and about an 8% less likely to have early AMD compared to people who are sedentary. I guess my best recommendation for people is, if any amount of physical activity, getting off the couch a little bit, being a little bit more active is going to be good. Get some movement in your everyday. And if you already are doing that, if you already get into the gym a little bit, see if you can do a little bit more. See if you can pick up some games of basketball or something fun to do with friends. Make it a game. Just a little bit more physical activity. It's amazing how good it is for the body, the brain, and then the eye. Sleep. Sleep is the next big one. So sleep is kind of fascinating because it affects so many different things in our bodies, in our brains, but it is associated with macular degeneration. So it's found that people who have sleep apnea and poor reported sleep qualities have higher risk of AMD. And people who have insomnia have a much higher risk of developing more severe forms of macular degeneration. Wet macular degeneration is higher associated with people who get less than 6 hours of sleep at night versus people who get 7 to 8 hours of sleep. The only caveat here is that there's not many publications on sleep and macular degeneration. There's a few of them, but it's not a lot. And they did report basically, while yes, it's associated, it's not as high of an association as diet, as taking the supplements, as weight loss. Those are much stronger factors. But I did want to emphasize how important sleep is and encourage that as much as possible. If you've ever had difficulties with sleeping, and I've definitely had challenges in my life, whether it be in school, after school, now in my career, there's definitely times I've faced it. Here are some tips that have helped me. One is having a sleep schedule and dedicated sleep schedule. So it's like, hey, my bedtime is 9 o'clock, 10 o'clock. I make sure that, hey, no, I got to shut everything off. I'm committed to it like I'm committed to work. It's that important for your health. So having that sleep schedule and having a routine around it. So I like to stretch for a few minutes before going to bed, just do a few yoga poses, stretch it out, and make sure I have all my screens and things shut off in a dark room. No phones or screens in the bedroom. That's a huge tip for you. It's not just the screen and the blue light, and we'll talk about that in just a second, but the phone itself, having something there to scroll and distract you is going to stimulate your brain, and that itself is going to keep you more awake and decrease the amount of hours that you're going to be sleeping. The screens, I know blue light's a huge topic, and we've talked about that on the channel here several times. Blue light does affect our sleep cycles. Digital devices do emit some level of blue light. Sun obviously is the main source of blue light. But when we do have light sources triggering our eyes, it speaks to a specific retinal cell that communicates to your pineal gland and then produces melatonin. Or I should say, your pineal gland produces melatonin, but if it's stimulated by light, it decreases the amount that's produced and delays it later in the evening. So thankfully, we know now that these apps on our phone have been developed, and they've studied this, that turning on the night modes where it turns more of a yellow amber color, that has a pretty good effect at shutting off this blue light effect to your brain. And so that might be one of the best things you can do, is just turning on that night mode. It's like up to about 90% in some studies that it'll shut down this, this melatonin suppression effect. Avoiding caffeine. I myself have had trouble with caffeine, drinking way too much of it in the past. Some people are more sensitive to caffeine than others because of how your liver digests it. Typically recommended, don't drink caffeine past noon. Or if you're really sensitive to it, don't drink caffeine 12 hours before you plan to go to bed, because that's about the average time it takes to clear throughout your body. Having a lower room temperature. Usually most people are better cold sleepers. Not everybody, but let me know if you prefer a cold room or a cold mattress, cold sheets, or if you're somebody who just like, you're too freezing and you need to cover up with lots of blankets. And then avoiding alcohol. And that's because while alcohol can make you fall asleep faster, unfortunately, the quality of sleep goes down pretty dramatically. And so those are all just some of the tips that I've included in my life, and hopefully that's able to help you out too. The final thing is don't smoke. And thankfully, I think a lot of people, especially here in the US, don't smoke as much as it was 20, 30 years ago. But smoking is known as the #1 modifiable risk factor to reduce your risk of developing macular degeneration and having a more severe form of the condition. The #1 thing, if you have a family member who smokes and you really wish that they would be able to quit, if you ever saw me in the clinic, I don't make people feel bad that they're smokers. I don't criticize or judge. I have family members who have smoked for 30 years before they are able to quit. It is the most addictive chemical on the planet. It's very difficult to quit smoking. The best thing you can do is be an advocate for them. So I always tell people like, hey, you know, it's not a health food. You know, it's not good for you. But when you're ready to quit, have you ever tried quitting? And if they struggle with quitting, I always tell people, let me know, because I'm going to do whatever I can to get you medication, patches, counseling, anything we can do to help you quit. And also celebrate their wins. If you have somebody has an addiction of any kind, if they're struggling with that and they're finding success, celebrate that win for them, because that is such a big thing. So let's talk about future treatments. We got Doc and Marty here looking off into the future. What is there for the future? Is there anything in development? So one of these topics I did just recently cover in a video on red light therapies, which is a really fascinating topic, and I've been diving really deep into it. And so I plan to make more videos on red light therapy. There's a lot of questions people have been throwing. So I'm going to try my best to get to those topics. It's just I want to do a really good job. So I have to really dig into the research to make sure I really know it before I start presenting on it. But if you haven't seen that video, check it out, because I do talk about some of the new treatments I think are just around the corner of being FDA approved here in the US. They're already approved and cleared in Europe, as well as in some locations in Latin America. So definitely check out that video for more information on treatments for macular degeneration. And then we do have this one, which is fairly new and kind of interesting. There's not much on it, but it's called microcurrent electrical stimulation. It's kind of like a TENS unit, but it's applied to the eye. And this is found to reduce inflammation, improve blood circulation, and improve mitochondrial function. And so people who have been being treated with this, some people are actually having improved eyesight after being treated with it. Again, not a ton of research, but kind of fascinating, and just something that we are paying attention to. I see a lot of different questions and things coming through. Thank you guys so much for being here. Before we jump into Q&A, I do have just kind of the medical advice disclaimer, but please right now, if you guys have questions, put in a bunch of question marks, like 3, 4, put your question so I can see it, and then a couple more question marks. That way it'll really stand out for me. With this live Q&A, I always start off by saying that, hey, I can't give you medical advice of any kind. This is really just a place for me to provide education. And that's not just to cover my butt, but it's really because I know that you deserve the very best eye exam, the very best health and advice. And the only way to do that is an in-person local eye examination. So if you have a question, please ask it for me here, and I'll do my very best to answer it in an educational way that everybody can learn from it. And a huge special thank you to all of our channel members and supporters. So again, thank you to everybody who are here this evening catching this live. So thank you guys so much. I know I've seen some other questions in here. I know I saw one about omega-3s from chia seeds. So chia seeds and other forms of plant seeds, even think of like hemp seeds, for example. I love to put that on my morning oatmeal or breakfast, either with my oatmeal, my cereal, or with yogurt sometimes. Those have ALA forms of omega-3s. ALA forms your body does convert into other forms of omega-3, like the EPA and the DHA, but it's not at a very high conversion rate. And I've dug into this and tried to find specific studies to show me what the conversion rate is. And the primary study is a bit old and honestly not super clear about what that conversion rate is, but it has been kind of confirmed by many other studies and specialists that it's just not as high. Most so omega-3s, fish, like fish oil is primarily the most common place people get and purchase omega-3s are synthesized from. And that's because fish actually eat algae, and algae is the primary source of omega-3s for the fish. So you can also get algal oil as a form of omega-3. But I couldn't find in the research how much of the phospholipid forms were in the algal oil, but I know it was in krill oil, the phospholipid is like 34%. But otherwise, the fish roe had a bit higher on average. But there are some forms of ALA that are out there in forms of chia seeds. It's still recommended, but that's a good question. This is a really good one, and I thank you so much, UFO Joe. Thank you so much for being a channel member. You're awesome. The question is, does staring at light cause MGD? This is a really good one because historically, it was believed that light and being outside, sunlight exposure, UV light exposure, and even maybe blue light exposure increase the risk of macular degeneration. However, in the last 5 or 6 years or so, a lot more research has more or less kind of shaded that original thought and is now currently not believed to increase the risk of it. Some doctors may debate me on that based on some of the older findings that it is associated with it. But again, if you dig into the more current research, like blue light from computer screens, not going to be causing macular degeneration. And we know that staring at the sun isn't good for your eyes, but it's largely not correlated with it. So, but thank you for asking that question. It is still a little bit of a debated topic in the industry, but more recent publications kind of shadow it a little bit. But thank you for that question. Let's see. This is a different topic. This comes from Tasker 109. I do a lot of dry eye treatments in the clinic, and we talk about it a lot here on the channel. But Tasker mentioned that his last doctor mentioned that they do IPL therapy and wants to know my thoughts. IPL therapy is a great treatment, especially for dry eye. IPL has been around for about 30 years. It stands for intense pulse light. It's been around for about 30 years, mainly used in dermatology. It's been used to get rid of fine lines and wrinkles on the face, help for rosacea. It treats varicose veins. It's got a lot of different applications. But about 12, 13 years ago, a famous ophthalmologist and his wife had discovered that IPL worked really good for rosacea, and all of their patients started getting better in terms of the dry eye symptoms. And then after about 12 years of research, they finally got it FDA approved, and that was about 2.5 years ago. And so that's kind of, in a way, been exploding in the eye care world as a treatment for dry eye because it helps burn off these, like, what are called telangiectatic vessels. They're little spider veins of blood vessels that grow around the eyelid. And that can shut off all the inflammation that's building up in the eyelids that's contributing to the development of meibomian gland dysfunction and dry eye symptoms. And I love it because not only does it help with your skin and complexion, but helps with your dry eye symptoms, gets your meibomian glands working better, but it has a longer lasting effect. And that's what I like about it versus some other forms of treatment where you're like, I'm stuck on this eye drop, this medication forever, it seems like, or I try this other treatment and it lasts for maybe a few weeks to a few months. But this treatment can potentially last many, many months, and then maybe just a maintenance treatment every 6 to 12 months. So I think it has a great application. And then there's even more, again, with red light research. There's some new publications that are kind of showing using red light in conjunction with IPL treatments, which is kind of fascinating. So hopefully that answers it. Thank you for that great question. What is the, let's see. There's so many questions coming in. This is from Kel L. What if your pupil is off center towards the left? What causes that, and what type of eye specialist should you see? So if there is a misalignment in the eyes in any direction, any eye specialist or any eye doctor should be able to identify that and do a cover test or do a few different eye muscle alignment tests to be able to at least detect, hey, is this a type of, is it an esotropia, exotropia? Are the eyes in or are the eyes out? Is there a muscle issue that's going on? Any doctor should be competent enough to at least make that diagnosis. And then if needed surgery or advanced treatment, they should be able to refer you. Otherwise, if you're an adult and you have an eye muscle alignment and require surgery, you'll end up seeing an ophthalmologist who specializes in what's called strabismus or strabismic eye surgery. If the eye's pupil is off toward the left, it's tough for me to know which left you're talking about. So it could be the eyes turning outward, which we call an exotropia. And then if it's turning inward, we call it an esotropia. But yeah, there's a lot of different types of different eye alignment issues that can develop. And it can develop for different reasons. Some people are born with that. Some people develop it because of how their eye muscles are not working because they have a high prescription and maybe they just need glasses. Or it could be because they had head injury or they had a stroke. There's a lot of different causes and reasons for eye misalignments. But hopefully that helps, Kel. Thank you. Tanya, thank you, Tanya. Tanya's having some trouble with her severe dry eyes. I'm sorry that you're going through that. I know you went to a dry eye clinic a few times. They wanted to do surgery. I'm interested to know what kind of surgery they'd be doing for the dry eyes. There are a couple different procedures that are classified as a surgical code, but usually for dry eyes, there's not too many surgeries. So I'd just like to know what that is. But what can I try that doesn't taste like fish? So yeah, fish oils can sometimes taste like fish. Even I tried the algae oil, and even that I was not a huge fan of the flavor. Although they usually put some level of like kind of lemon scent in there to make it taste a little bit more lemon. I haven't personally tried krill oil. Maybe other people here in the comments can answer that if they've ever tried something like that. I know that there are publications on flaxseed oil showing benefit for dry eye. There's not too many of those studies, but again, that's more of the ALA form. But I do recall at least one study, and I think it was a lot. I think it was like 6,000 milligrams. But you may want to ask your local eye doctor or try to research it yourself a little bit, but flaxseed oil may be an alternative to that. There are also, I can tell you, there are some new research coming out on specific supplements for dry eye that should be launching within the next few months. So we should stay tuned to the channel because we'll be talking about all that new research that's coming out and the new products that are coming out because of that research. So pretty cool. Let's see here. I see Linda asked about, have I seen Dr. Chris Kenobi, an ophthalmologist, on his nutrition that he recommends? So Dr. Kenobi, I have seen some of his lectures all the way back into 2020. Some pretty fascinating kind of research he's done. His kind of research goes on looking at different types of seed oils and its relationship to increasing rates of macular degeneration. So I do think his research is quite fascinating. It's not largely accepted in the eye care space as of yet. So I think with all of that research, it has to be digested and agreed upon by basically the rest of the scientific community. I think he might be onto something, although there are still debates about seed oils, and most of the good research on seed oils doesn't kind of drift as negative. But we do know, again, from what we presented earlier, that diets high in those fats, even these, because the processed foods have a lot of these like modified, seed oils and things like that, that I think that if you have higher amounts of saturated fat or just fat consumption in general, that also, at least based on those epidemiological studies, suggests that you're at a higher risk of AMD. It's great that he's out there doing research, and I'd love to hopefully someday meet him and be able to ask him a bunch of questions. But question from Frederick. Question: could you talk about your take on yellow filters and magnification eyewear as tools? I'm not sure if you're talking specifically about macular degeneration, but yellow filters. So yellow filters can have some application just in eye care in general. Like sunglasses with more of a yellow tint to it can enhance contrast and improve distance perception a little bit. It doesn't necessarily help you see better on an eye chart, but it can improve your perception of distance things. And that's why people who are professional drivers sometimes wear yellow tinted lens filters. Some sharpshooters and people who are in competitive gun sports, they will wear yellow filters, things like that. The idea of yellow filters to prevent macular degeneration, again, at one point was believed that it could potentially help. More recent publications suggest no. One of the reasons for that is they started doing cataract surgery and putting implants into the eye that had yellow filters built into them. And after, I think it was like 15 years of research on that, they found that the people who had the yellow filters had no reduced risk of macular degeneration versus people who didn't have the yellow filter. So that is at least one strong research that basically said that no, yellow filters aren't going to slow down macular degeneration. Magnification eyewear as tools. I mean, magnification is important because it helps us see sharper. Certainly, people with low vision, people who have macular degeneration and reduced eyesight because of that, magnification is super important so that they can see their best and have the most usable part of their vision. So yeah, hopefully that answers a little bit. If you have other kind of questions around that, please let me know. I'll try my best to get to that. This one is from, I'm going to say Laney Smudjovitz. Love that name. It says, once asked if you're looking at the sunset is bad for your eyes. So thank you so much. So yeah, the question about sunset. So looking at the sun, we know is a high risk, and especially at the peak part of the day, the energy from the sun can easily burn a hole into the retina in the back of the eye. We call that solar retinopathy. And that's why there is so much safety information around the time of the eclipse this just a few months ago, is because we didn't want people to accidentally look directly at the sun. During the early morning rise and then of course the sunset, there is still risk of potential photo-oxidative damage occurring inside the eye. It's not as much of a thermal damage as it is like a chemical damage that occurs inside the eye. So there still is risk. I think if it's really low in the sunset, if it's painful, don't look at it. But if it's really low in the horizon, it may not be as big of a factor. But I personally wouldn't suggest directly staring or gazing into the sunlight. Even with sunglasses on, sunglasses are not strong enough to filter out the harsh energy of the sun, and people can still have permanent damage in their eye from gazing at the sun, even with sunglasses on. I wish I had a better answer for that, but the largely agreed upon like safety answer is don't stare directly at the sun. Yeah, sunsets are beautiful though. I'll give it that. This is an interesting question. I would love, Miranda, if you can, let me know what moon contact lenses are. Maybe that's just a phrase for a different type of contact lens. I know there are some contact lenses that are designed for people to sleep in, such as Ortho-K contact lenses, for example. And then there are some forms of soft contact lenses that are FDA tested and approved for overnight wear. However, no matter what, if you're sleeping in contact lenses, you're at much higher risk of infection. Usually, though, if your doctor approved for you to wear a certain contact lens while you're going to bed, staring at your phone shouldn't be a problem before going to sleep. However, no matter what, staring at a phone screen, you usually don't blink as often and you don't blink as completely. And so just the eye being open, exposed to air, the eyes are going to tend to dry out more. And that's with and without contact lenses, but even more so if you are wearing contacts. So thank you so much for that question. Hopefully that helps some people out. We have just a few minutes left, so I'm going to try to make sure I get it to as many of these questions. Let's see. I know the question from Rosebud, does AREDS 2 work? So research, again, as we said earlier, does show that AREDS 2 supplements do slow down the progression of macular degeneration. Depending on the analysis, somewhere between 8 to 25% over 5 years. It'll slow down that risk of progression to a later stage by about that much. So yeah, they are recommended. And again, it's one of the best things we have right now for that stage of the condition. And then Cornflower Crafts, thank you so much. Does having dry eye disease and cataracts, does cataract surgery, is it really rough on people with dry eye syndrome? Yes. So that's in fact been kind of the trend in the industry, is that we know that people who would have cataract surgery, they tend to get really bad dry eye afterwards. Some people, not everyone, but some people tend to get really bad dry eyes afterward. And so we started analyzing this a lot more and finding out that people who have dry eye before cataract surgery, it can trigger it and make it worse. And some people have subclinical dry eye, like they have dry eye, but they don't feel the symptoms. Like they've gotten used to it. Like their eyes, like they're not even like aware of how dry their eye is anymore. And so now there's this kind of push in the world of eye care to detect dry eye before cataract surgery and be more aggressive about managing it, getting someone on medication, having procedures like IPL months before cataract surgery. Because if we can stabilize the tear film, then when we do all of the measurements for cataract surgery, the measurements are going to be more accurate. And then the recovery process from the procedure is going to be better. And you're going to have better vision afterward and be more comfortable. So it's that is true that because of the procedure itself and the inflammation that comes from that, but then all of the eye drops that we need to put someone on for the cataract surgery, they have preservatives, and that can disrupt the tear film. So those hopefully that helps answer that question. I know we're basically running out of time. It's been a full hour. Thank you guys so much for being here. If you have further questions, continue to drop them in the comment section for the next several days. Basically for the next week, I'll be answering questions specifically on this live stream. So please drop those questions in there. Thank you guys so much all for being here. For further information and about macular degeneration, if you want to know a little bit more, I do have another video on wet versus dry macular degeneration, and I'll put that coming up here to the side. And stay tuned for more information on new research on omega-3s and other eye supplements that that's about to be launching. So thank you guys all so much for being here. I hope you have a fantastic day.